And let me just first say I'm so honored to be here. I have learned so much. To Trina's question, why am I here and what am I hoping to get out of it? Just to learn. I'm not a food as medicine expert. Let me start by saying that. Let's set the bar low here. And then what do I think I have that you might be interested in? What I do is I'm an advocate for federal nutrition programs, primarily SNAP WIC and child nutrition programs, and I'm a person who works in systems change. So taking really complicated problems and trying to make them manageable and approachable on a statewide scale. And so I'm going to talk a little bit about that today in 15 minutes, if that's possible. So what I'm hoping y'all will get out of today is just a little bit of a framework for how we approach changing systems in Oklahoma, and might find something relevant for the work that you do, and maybe a little bit of hope, because I think a lot of y'all here are doers, and sometimes when you're a doer, the amount of time it takes to change a system becomes kind of unbearable. And so I want you to know that it is possible. You're doing good work, and you will change the system. So a little bit of a background. In 2016, I worked at Baylor University, and we were hired by the Ann and Henry Zero Foundation in Oklahoma to come do a study. And the study they wanted was, in basic terms, why are we spending tens of millions of dollars a year on food insecurity in Oklahoma and making no difference? The foundations in Oklahoma were frustrated that they were spending all this money and they couldn't see an impact. And so at Baylor, we spent about a year collecting data, having hundreds of interviews and conversations, and trying to get to the bottom of what was going on. And so to start us off, food insecurity. Oklahoma was one of the hungriest states in the nation. That's what all the headlines in the newspapers read in 2016. We were top 7 states in the country for the worst food insecurity rates. And we had a higher food insecurity rate than all the states around us, including Texas. And in Oklahoma, we compare ourselves to Texas in all things, it seems like. And so that was pretty frustrating for Oklahomans. In addition to our terrible food insecurity rate, Oklahoma has some of the most alarming health statistics in the country. And many of y'all will be familiar with these already, but one that was new to me when I started was 58% of kids in Oklahoma didn't eat a single vegetable in a day. So that was pretty alarming. Add that to the 49th in the country for fruit and vegetable consumption. Only 3.2% of Oklahomans eat the recommended amount of fresh fruits and vegetables every day. And we're also in the top 10 worst states in the country for diabetes, cholesterol, high blood pressure, and so on and so forth. The list is too long to sit here and list to you today. And so things looked pretty bad. And yet, Oklahoma was leaving, as the title of the article said, $400 million a year on the table to address hunger. So we had this terrible problem, and yet there were hundreds of thousands of people eligible for programs that weren't participating, and those were all programs that would cost the state $0 to implement. And so this was part of the problem. This was contributing to the problem of hunger in Oklahoma. And so Baylor published this report, and then I was lucky enough to be offered a job to move to Oklahoma full-time and to start to think about, well, what do we do? We have all this terrible data. Now I need to think about what's the solution. And so I got to do something that's pretty crazy, which many of y'all would maybe empathize with, which is for an entire year, I got paid just to listen to people. Didn't have to do anything. We just talked and listened and heard what was going on. And if you're grant funded, you know that's not a very normal thing. So I felt very fortunate to do that. And we came up with this mission, leveraging the power of collaboration to solve hunger in Oklahoma by improving systems, policies, and practices. And at the time, we came to that because in hundreds of interviews, 4 main words kept coming up every time we talked to someone: collaboration, systems, policies, and practices. And so what we were seeing was that there were 4 major contributing factors to why we weren't making change on food and nutrition security in Oklahoma. The key stakeholders weren't talking to each other. There was no venue for the people on the ground running programs to talk to the state administrators or the USDA. People doing great work in the panhandle of Oklahoma weren't sharing notes with people doing great work in the eastern part of Oklahoma. There was just no communication across organizations and across institutions. Our second piece that we focused on was systems. Oklahoma's systems were fundamentally broken. Whether intentionally or unintentionally, that's up for debate, they weren't working. And one example I like to share is we published in our report after doing probably 20 interviews about SNAP And doing a full and exhaustive search of the state's website, we published in our report that there was no way to submit a SNAP application online in Oklahoma. You had to go to a physical office. In 2016, the internet had been around for 20 years. In 2016, you had to go to a physical office, of which there were 50 in the state. We have 77 counties, and submit a SNAP application. 6 months later, I got a call from the director of DHS, and he said, Richard, don't tell anybody, but we do have an online SNAP application. We just don't want them to know. Obviously, my job was to do the opposite of that, and we immediately told a lot of people. No, that's not true. We spent a lot of time building a relationship with DHS so that they could feel safe and comfortable in releasing that online application in a way that felt controlled to them, but created access, and I'll talk a little bit about that later. The third thing we noticed was that the policies in Oklahoma were lacking. They were far behind the policies being advanced in other states and even across the nation. And that's big P policy, so legislative policy, but also administrative policy, how administrators were choosing to implement the programs that we run. And then the final thing was practice. Not many people in Oklahoma were willing to touch a federal nutrition program with a 10-foot pole. They thought they were too burdensome. They thought that that was the role of private philanthropic dollars to fill those gaps. And so what we saw is where kids could be getting 2 free meals a day during the summer, instead they were getting a juice box and a bag of Cheez-Its, instead because we were paying for them out of our operating dollars of our nonprofits. And so with that in mind, we ended up with this idea that ending hunger in Oklahoma required changing systems, collaboration, policy, and practice. And so I'm going to briefly talk you through a couple examples about how we apply that framework to our work in Oklahoma to really address hunger and food insecurity. So thinking about child nutrition security, which is the #1 issue, 1 in 4 kids in Oklahoma in 2016 were food insecure. It's up to 1 in 5 now, so we've made some progress. But child nutrition security was our major problem. And so when we start on this framework, we think about what are the barriers to systemic change, what are the barriers to collaboration, what are the barriers to policy priorities, and what are the barriers to practice. And then we work backwards with data, lived expertise, interviewing and talking to the people who are actually doing the work and looking at national best practices. We work backwards from problems to solutions. And so in child nutrition security, to use summer feeding as an example, because Oklahoma for 10 years was 51st in the nation for feeding kids in the summer. So to take that as an example, we started with the barrier. The system was not built to work in rural Oklahoma. 33% of Oklahomans live rurally. The vast majority of Oklahoma's poverty is centered in rural Oklahoma, not urban Oklahoma. And so the system didn't work. It wasn't set up for that. The collaborative problem was the same thing I talked about earlier. There was no venue for the state and the people who were actually doing the work on the ground to talk to each other. So rules about summer meals would come down from nowhere with no recourse to ask questions about those rules or get help implementing those rules. The policy problem was that congregate feeding was required. Kids in rural Oklahoma sometimes had to travel 10, 20, or 30 miles in the middle of a workday to sit down and have a meal for 30 minutes, as opposed to picking up meals 1 day a week for the entire week. And then from a practice standpoint, there were only in most of Oklahoma, there was only 1 site per 1,000 children. And if you think about Woodward, Oklahoma, which is a state that has a land area as big as or a county which has a land area as big as some states in the country, when only has 3,000 children living in it, 3 sites in a county that large just isn't going to meet the need. And so we work backwards into solutions for those, and I'm not going to spend too much time because I don't think that that's the primary idea here, but we work backwards into those. And one of the things that I think this table shows is that things can fit pretty neatly into these boxes. What it doesn't show is that these things don't all run on the same timeline. The solutions we started in the policy world to solve hunger in 2016, to solve summer meals, we just got those across the finish line last year. So last year, the Congress finally passed a non-congregate feeding bill, and they finally implemented summer EBT. So we worked on those policy priorities for 7 years before we saw change. But on the other hand, in the practice area, we had early wins, and we did them quickly. So we're on our 4th iteration of practice in Oklahoma on improving the on-the-ground conditions of summer meals. So we started by just getting 1 site per 1,000 kids. That was the goal. Now we're moving on to congregate and non-congregate feeding. We launched 55 non-congregate feeding sites last year, which was the first year we were allowed, and this year we're on track to do 200 non-congregate sites. And that's hugely important. I think as a quick example before I get off this topic, as you can tell, I care a lot about feeding kids in the summer. But as a quick example, we have a partner who served 15 congregate sites previously and only served 300,000 meals in a summer. Last year they changed to non-congregate. They served 3 sites and served over 1 million meals in the same time. So think about the increase of reach and capacity by making this one policy win. So to what y'all care about, I think, which is access to nutrition. And so one thing I skipped earlier was talking a little bit about how we fit into the food as medicine work and why I'm here and why this is even relevant to me today. We've seen the picture of the pyramid multiple times, and I think our work really sits on the base of the pyramid. The policy interventions and the population level solutions, we have to have those two things so that the top of the pyramid can get filled out. I heard a lot of y'all talking about what happens when someone leaves our program in 6 months. And the answer is if they don't have access to healthy food and they don't have money to buy food, then not a lot happens. And so that's really where we see our opportunity and our place to serve. And so with that in mind, a lot of our work is around creating the enabling conditions to achieve nutrition security. So we're not the awesome people on the ground doing the hard work of food as medicine, but we are trying to create a space where food as medicine programs can flourish in Oklahoma. And I think we have been successful, and we're having more success in that space. So the 2 areas we care about and focus on the most are SNAP and Double Up Oklahoma, which is our nutrition incentive program in Oklahoma. And so I'll talk to you quickly about some of our SNAP initiatives. Our number 1 SNAP initiative is obviously getting people signed up for SNAP. 80% of Oklahomans were participating in SNAP. Eligible Oklahomans participated in SNAP in 2017. That's up to 85% now, which we're very proud of. But it doesn't matter if you have SNAP if you don't have somewhere to spend it. And so from a policy perspective, one of the great policy wins we've had in the past few years is our Healthy Food Financing Initiative, which allows, it's a state-paid program, which gives non-traditional grocery outlets, so think corner stores, farmers markets, food stands, grants of up to $10,000 or loans of up to $500,000 to increase the capacity to serve wholesome food. So fruits, vegetables, meat, dairy, and grains. And so the idea is so that people will have more access to SNAP in Oklahoma, or when people have access to SNAP in Oklahoma, they'll actually have somewhere to spend it. Oklahoma has about 60% of our counties have some kind of food desert, low-income, low-access area in them. So there are a lot of places where people who might have SNAP don't have somewhere to spend their money. And then finally, on the food affordability front, Double Up Oklahoma is our nutrition incentive program. It matches dollar for dollar people's SNAP purchases for fresh fruits and vegetables. We operate in 13 grocery stores and 30-something farmers markets right now, but this year's a huge expansion year for us, and so by the end of the year, we should be at about 40 grocery stores. And the idea there is that, once again, time and time again, we see that people would buy more fresh fruits and vegetables if they could afford them. And so how do we increase the affordability of fresh fruits and vegetables? How am I doing on time, Elizabeth?
5 to 8 minutes.
I'm trying to rush.
You're on the wrapping it up end, I hope.
I'm hustling. I'm getting there. Yeah, we'll be there. And so this model has worked well for us, and I think we could go a lot more into the framework. I did maybe not the best job of explaining it, but hopefully you get the general idea that we're breaking complicated problems into measurable chunks that center our mission and allow us to focus where we have our biggest locus of control as Hunger Free Oklahoma. And the results we've seen are promising. 5% increase in SNAP participation. We were one of the first states in the country to have an investment from the state in nutrition incentive programs. And we're not talking a small investment. We're talking $3.5 million a year investment. Unfortunately, to scale the program, we would need to have like $50 million a year, but we're getting there. Fruit and vegetable consumption amongst Double Up Oklahoma participants is higher than the state average, so we're seeing movement in that direction. And summer meals participation, Oklahoma has moved from lowly 51st to lowly 47th, and we're proud of that. We'll take it. It's a win. But one of the things I think is important is if we're creating the enabling conditions for change, these are just part of the story. We're also having to measure changes in political will. When I started in Oklahoma, all the bills in the legislature about food were trying to stop people from accessing it. And this year, we were very proud to see 5 Republican-led bills trying to increase access, including free universal meals for children in our Senate and House. So we think that's positive. And we're also seeing a change in, thank you. Yeah, very, very pleased with that. And we're also seeing a change in public perception. And that's one of the things I'm most excited about. So every year, we put out a poll. It's a representative sample of Oklahomans by congressional district to try and understand how they feel about food insecurity, hunger as a priority, a policy priority, but also access to nutritious fruits and vegetables. And this question is one of my favorite questions. We present randomized facts about the importance of eating fruits and vegetables, and then we ask them, basically, do you think it's worth incentivizing people who participate in SNAP or who are low income to buy more fresh fruits and vegetables? And overwhelmingly, what is that, nearly 90%? Of Oklahomans, Republican, Democrat, Independent, say that yes, the state should be investing dollars in helping people access more fresh fruits and vegetables. And so if you think about that as a policy change, who do our Congress people listen to more than anything? The people who vote for them. And so if 90% of Oklahomans are willing to say, yes, we should invest, we think that that is a win. And it's progress. And so we take this to the legislature this year and see if we can get another $5 million for fresh fruits and vegetables for Oklahomans. So with that, I think I'll wrap it up. And I appreciate y'all's time. Thank you.
Thank you so much, Richard. And as Corby comes to the stage and we load his slides, any burning questions for, I knew you're doing, no. Okay, so, yeah, well,
yeah, I think we're always happy to share our public polling. It is representative of Oklahoma, but there's good statistics there, I think, for anybody who's interested. And some of it's available on our website, but if you need more details, happy to share. So.
Hey, I got a question. Is your healthy food financing, is that also supported by the state?
Yep, healthy food financing is a $500,000 investment from the state to start. And if we do good with that, we've been promised more. So we'll see.
That's just, okay.
Yeah.
Okay, thanks.
Mike's everywhere.
Yeah.
Any other questions for Richard? Okay,
right.
Thank you so much. And all of us in a also somewhat conservative state really respect and acknowledge the hard work that's happening down there. One of the things I was so happy Richard was here today to chat with you all is to start building those connections between our states. Like, we're right next to each other. We have the same issues. Let's work together.